Okay, so we left off talking about the different pathways of the sympathetic nervous system, and we said there's an adrenal medulla pathway where preganglionic neurons from the spinal cord can exit the spinal cord, and then the axons go over to the adrenal medulla, which just sits on top of the kidney, where those neurons can excite the cells of the adrenal medulla to release epinephrine and norepinephrine. So epinephrine is adrenaline, norepinephrine is noradrenaline. And they're just two different hormones that they often interact with the same receptors. One can be more potent or strong than the other, but they have very similar effects on receptors. So this is sort of like a duplicate pathway here. So throughout our thoracic and abdominal areas, we have a lot of what are called autonomic plexuses. And like other nerve plexuses, it's actually a lot of nerves that intertwine and mix and spread out. We said a plexus literally is a network of something, right? A network of nerves. So autonomic plexuses are collections of sympathetic postganglionic axons and parasympathetic preganglionic axons, as well as visceral sensory axons. Now, these sympathetic and parasympathetic axons are close to one another, but they don't interact. They don't communicate with each other because they're parts of different branches of your nervous system, right? So in terms of the types of autonomic plexuses, we find that they're typically named for what they're next to. So we'll have an aortic plexus over here just right on top of the aorta, and it's involved with regulating functions of your heart. And then we have other nerve plexuses nearby, like the hypogastric plexus in the pelvic area. We have the inferior mesenteric plexus and renal plexuses nearby, and celiac plexuses, which are involved with communication with the stomach and the liver. So the cardiac plexus is the mediastinum near the thoracic cavity, and it consists of postganglionic axons and thoracic sympathetic trunk ganglia. What we find then is that this cardiac plexus, it's involved with regulating heart rate and the force of contraction. So increased sympathetic activity through the cardiac plexus here increases heart rate and blood pressure. And blood pressure is increased because the sympathetic nervous system can cause your heart to contract more strongly. So with every beat, if it can force blood out more strongly, then blood pressure will be elevated. Now, part of the cardiac plexus also includes parasympathetic neurons. But if you increase the parasympathetic activity on the heart, what would that do to the heart rate and blood pressure? Decrease, yeah, both. Good. So we also have a pulmonary plexus, and the pulmonary plexus here has parasympathetic and sympathetic functions. And remember, so the pulmonary means lungs, right? So think about what your airways need to do with each phase. If you're in the sympathetic phase, like fight-flight, do you want more or less airflow if you're sympathetic active? More, right? And the way you get more airflow is through bronchodilation. So if you make your airways wider by relaxing the smooth muscle in those airways, that's the effect of the sympathetic nervous system. That way you get more airflow while you're sympathetically active. But oddly enough, you guys, increased sympathetic activity inhibits smooth muscle along your airways, which causes that smooth muscle to relax. That way your airways widen, or we say bronchodilate. So you get more airflow while you're sympathetically active. Makes sense. And opposite to that, you guys, the effect of the parasympathetic nervous system on your airways is to cause bronchoconstriction, which is basically where smooth muscle contracts in response to increased parasympathetic activity, so that you don't need as wide of airways for airflow, so that the airways can be more narrow and you get less airflow because you don't need bronchoconstriction. An example of bronchoconstriction, is it normally occurs.
Sort of like a response, yeah, like as a response. I guess.
Well, because you don't need as much airflow if you're just if you're resting and digesting. Okay. And the reason why you don't want as much airflow is that if you had too much gas exchange, it would change the pH of your blood beyond normal limits. So in order to kind of maintain balance, what we can do then is that we can match ventilation or airflow with our metabolic rates by bronchoconstricting, where if your metabolism is slower because you're resting, well, then you can also have less airflow. So you want those things to be fairly well matched. Now, an esophageal plexus here consists of axons from the vagus nerve, and it's parasympathetic activity that causes smooth muscle contractions during the swallowing reflex. So if you think about how far your esophagus needs to go, first of all, it starts pretty high up in your neck, right? Just underneath your chin there. The esophagus starts back there. The esophagus goes all the way down your neck, all the way down your thoracic cavity, and it has to get all the way to the stomach, just below your respiratory diaphragm. So from here to there. You might wonder, well, how does food get from here to there? Like, you don't have to think about swallowing beyond your mouth, right? Beyond the mouth, the esophagus takes over in a reflexive manner. And you're right, it's actually peristalsis. So you actually get these waves of smooth muscle contraction that are mediated by the esophageal plexus, which are branches of the vagus nerve. So what do you guys think would happen if someone had problems with their vagus nerve in terms of swallowing? Like, let's say if their vagus nerve were damaged, how well could they swallow then? Yeah, they might get difficulty swallowing or dysphagia, where the food might get stuck in their esophagus somewhere, because then you don't get this reflex where, you know, the smooth muscle contracts. Could you imagine swallowing the food just getting stuck right there? It happens sometimes, I'm sure. Like, I know it's happened to me before. Yeah, like chips or something. Yeah, it could just kind of stay there. But fortunately, that's sort of propelled along by waves of smooth muscle contraction that are mediated by this esophageal plexus. Now, other autonomic plexuses we find in the abdominal cavity would be like the aortic plexus, the celiac plexus, superior and inferior mesenteric plexuses, and these are going to innervate most digestive viscera. Now, remember, a plexus is a network. So you might wonder, well, what's the purpose of having an autonomic plexus in the digestive viscera? Well, like other nerve plexuses, there's redundancy. So if once something gets cut, then there's other way for information to get around that cut. That we don't lose all function of your, digestive system. So it's kind of interesting. Now, the hypogastric plexus is a meshwork of postganglionic sympathetic axons that you find in the lumbar region. And what we find then, you guys, is the axons of the hypogastric plexus innervate the viscera within your pelvic region. So if someone has hypogastric plexus anomalies, then you might see that the pelvic organs are dysregulated. Like they might have odd bladder contractions, or they might not be able to control their rectum, right? So then they might get inappropriate rectal contractions, or maybe the anus sphincters won't contract, so they're more open, and so feces leave abnormally. Or you might see that someone can be inappropriately sexually excited. And you guys may have heard about this before, like in spinal cord injury patients, right? Where in terms of reflex mechanisms, you might be working with a male spinal cord injury patient who just, for whatever reason, has an erection. And it's not because they're emotionally sexually excited. It's just that because their brain can't communicate with the hypogastric plexus, that they can't control their erection. And so it just can kind of happen out of nowhere. Or it might happen with just the slightest little stimulation of their penis. And so that if there's a reflex back to the spinal cord and then back to the penis, well, then you might get an erection as a result. But if the brain can't prevent that, then the person's sort of stuck with that, if that makes sense. So if you're working with a spinal cord injury patient and they have an erection, it's probably not because they're interested. They probably just can't control it. Yeah, you've seen it? Yeah. So what we're going to do next, you guys, is talk about some of the neurotransmitters of your autonomic nervous system. So we have preganglionic and postganglionic neurons. We said that those neurons communicate with each other, right? Well, the way they communicate is through the release of neurotransmitters. Like we talked about earlier, the neurotransmitters are chemical signals exocytosed from one neuron, and then those neurotransmitters can bind to receptors on the next neuron, or the postsynaptic neuron. So what we find then is that the preganglionic neurons can release the neurotransmitter acetylcholine. So the preganglionic neurons of both your sympathetic and parasympathetic nervous systems both release acetylcholine. And that neurotransmitter also binds to nicotinic receptors on the postganglionic neurons. If you guys remember, that sounds pretty familiar, right? Like back in skeletal muscle, we said that motor neurons released acetylcholine that bound to nicotinic receptors on skeletal muscle, which then caused the muscle to become excited, and that can lead to a contraction, right? Well, the same neurotransmitter and the same receptor are used in this process. So all preganglionic neurons release acetylcholine, and that binds to nicotinic receptors on those postganglionic neurons. But nicotinic receptors are always excitatory. So the preganglionic neurons can always excite the postganglionic neuron. Okay? They do this because they release acetylcholine right onto the receptor. That when acetylcholine binds the nicotinic receptor, it causes action potentials to be generated in the postganglionic neuron, which then gets sent down the axon, right? Now, what differs, though, between these two systems are the neurotransmitters released by the postganglionic neurons and the receptors that those interact with. So that in both sympathetic and parasympathetic systems, the neurotransmitters released by preganglionic neurons are identical. And those bind to receptors that are also identical. So that, those wouldn't be good pharmacological targets because they're too similar. Like you couldn't differentiate between sympathetic and parasympathetic nervous systems based on nicotinic receptors because they both use them, right? Nor could you differentiate on them based on acetylcholine because they both use acetylcholine. But where they differ is in the post-ganglionic neurons, remember the one that's second in the chain of events, that these neurons release different neurotransmitters, whether it's sympathetic or parasympathetic, and that those neurotransmitters released by a post-ganglionic neuron bind with varying types of receptors that have a variety of different responses. That's where they differ. So depending on the receptor, what's interesting, guys, is that that's going to determine the effect on that effector organ, right? So let's say if you had a muscarinic receptor on an organ. Well, a muscarinic receptor is sensitive to acetylcholine, which is released by the parasympathetic neurons of your, or postganglionic neurons of your parasympathetic nervous system. Muscarinic receptors can either be excitatory or inhibitory. So it just depends on the type of receptor. In fact, there's many different types of muscarinic receptors. Now, for the sympathetic nervous system, we find adrenergic receptors on the organs that are sensitive to adrenaline, hence the name adrenergic, right? If they're sensitive to adrenaline, then adrenergic receptors, that's an appropriate name. But what's another word for adrenaline? Epinephrine, good. How about what's another word for noradrenaline? Norepinephrine. So you want to know them both ways. But it kind of makes sense with respect to why they're called adrenergic receptors. So we'll see a slide here. Now, acetylcholine's release from sympathetic axons is only excitatory. So some postganglionic sympathetic neurons can release acetylcholine, but only in very rare circumstances, like for ones that are involved with sweat glands, blood vessels, and skeletal muscle. But most postganglionic sympathetic axons release norepinephrine onto their effector organ. And the effector organ is just what's being communicated with, right? So an example of an effector organ would be like your heart, your airways of your lungs, your digestive viscera, your kidneys, reproductive organs. And depending on the type of receptor, norepinephrine can either be excitatory or inhibitory. And we've already talked about examples of each, right? So what's the effect of the sympathetic nervous system on your heart muscle?
One more time.
What's the effect of the sympathetic nervous system on your heart muscle? Increases heart muscle contractility. Good. But what's the effect of the sympathetic nervous system on the smooth muscle of your respiratory tract? It inhibits smooth muscle contraction. It causes it to relax. But what if I told you guys, though, that in both systems, it's the same neurotransmitter being released. They're just interacting with different receptors. So that depending on the subtype of the adrenergic receptor, it can either lead to a positive response or a negative response. So on the heart, we have a different type of receptor that once it binds with norepinephrine, that causes the heart muscle to contract more strongly. And in the smooth muscles of your airway, then what you find is that actually those receptors cause relaxation of the muscle, not contraction of the muscle. So that it depends on the receptor that also ultimately gives us an idea of whether it's excitatory or inhibitory on that particular organ. So what this slide shows here, you guys, is a good overview of the neurons of your parasympathetic and sympathetic nervous systems and the neurotransmitters and receptors used by each. So for our parasympathetic nervous system and the sympathetic nervous system, we find pre- and post-ganglionic neurons. Now, what's not shown here, you guys, is other differences, right? Like these shouldn't be the same length. They should also have varying degrees of myelination. That's not the important point on this slide, though. What we care to talk about, though, are the neurotransmitters released by your pre-ganglionic neurons. So what do we see here, you guys? What do all pre-ganglionic neurons release? ACH, acetylcholine. Good. And then acetylcholine, released by these pre-ganglionic neurons, always interacts with what type of receptor?
Parasympathetic?
Both systems.
Oh.
Nicotinic receptors. So what if you blocked nicotinic receptors? Which system would it affect? Both, parasympathetic and sympathetic. What if you blocked acetylcholine synthesis? What system would it affect? Both, parasympathetic and sympathetic. Good. So those wouldn't be nice, unique targets, right? Not for a drug. It wouldn't make sense. So what does differ, though, you guys, is beyond that. We talk about what's released by the post-ganglionic neurons. For the parasympathetic nervous system, it's acetylcholine again. However, acetylcholine here binds to muscarinic receptors on the target organ or effector organ. Now, what's interesting, you guys, is that muscarinic receptors can vary in their subtype. Some are excitatory, some are inhibitory. But the reason why they're called muscarinic receptors is that they were identified and discovered from a mushroom toxin. So, if you guys ever heard of a mushroom called fly agaricus, it's the one that's sort of red with white polka dots all over it. Or was it white with red polka dots? Red, yeah, red with white. They grow in Colorado. You can see them out there. They also grow in Europe. But this mushroom is somewhat toxic to the body. And, people who take it say that they get kind of like a drunk-like feeling, but it also makes you violently ill. So it's not the kind of mushroom you want to go out and eat if you want to try to get high off a mushroom, right? It's going to make you sick. Now, instead, what happens, you guys, is that the muscarinic receptor here, there's actually a toxin in that fly agaricus mushroom, that interacts with these muscarinic receptors. And so you actually get excessive parasympathetic responses from this toxin. So what do you guys think would happen then? Like you eat this mushroom, and the toxin in the mushroom binds to a muscarinic receptor, but it activates muscarinic receptors. What do you guys think would happen to your heart rate? Get really slow, right? What about your blood pressure? Really low. You might even lose consciousness, right? What about your digestive system activity? Increase, right? But what if it increased too much to the point where you got like stomach upset? Like imagine if your stomach was grumbling and trying to secrete acid, even though there's no food there. That's why people feel ill when they take this mushroom, because it actually causes too much activity of their GI organs. So it's interesting.
So that can make you vomit?
And it could make you vomit too, exactly. Yeah, because you might get so much acid in there that the reflex would just be to release it. Now, what we find then is these muscarinic receptors are usually only associated with the parasympathetic nervous system. However, you do find it with the sympathetic nervous system associated with certain things like sweat and blood vessels and skin. Sweat glands and blood vessels. But for the most part, it's really just associated with the parasympathetic nervous system. Now, are muscarinic receptors only excitatory? No, they can be inhibitory too. It just depends on the subtype, and there are different subtypes of these receptors. Now, what about the postganglionic neurons of the sympathetic nervous system, you guys? What do they release? Either acetylcholine or norepinephrine. What's another word for norepinephrine? Noradrenaline, right? Now, in this pathway, it looks really similar to the parasympathetic pathway, right? In fact, if you look at these, they use the same neurotransmitters and they use the same receptors. However, this is still technically part of the sympathetic nervous system, but this is a very rare branch of the sympathetic nervous system that really just associates with your sweat glands, blood vessels, and the ones you find in skeletal muscle that increase blood flow to skeletal muscle. Okay, so let's say if you had a drug that increased muscarinic receptor activity, what might happen to the sweat glands throughout your body? Yeah, they'd increase. Exactly. Or let's say if you had a drug that increased muscarinic receptor activity, what would happen to the digestive muscle throughout your body? It also increased in activity. You got it. But they're affecting different systems, although these two systems use the same receptor. Now, that's kind of funky, you guys, so don't worry too much about this. But what we want to focus on more so, though, is this pathway here, where we have our preganglionic neuron releasing acetylcholine. That binds to muscarinic receptors on this postganglionic neuron. And our postganglionic neuron in the sympathetic nervous system releases norepinephrine onto adrenergic receptors. And they're called adrenergic receptors because they're sensitive to adrenaline, whether it's noradrenaline or just adrenaline. So they're sensitive to both, hence the name adrenergic receptors. And you find adrenergic receptors on pretty much every other body tissue. So if it's not a blood vessel or a sweat gland, blood vessel and skeletal muscle or a sweat gland, you're going to find that they're adrenergic receptors associated with the sympathetic nervous system. Okay? So what if someone gave you an adrenergic receptor blocker? What do you guys think would happen to your heart rate? Slow down, right? What if someone gave you an adrenergic receptor agonist or enhancer? What would that do to the smooth muscle of your airway? No, it's enhancing the effect here. Yeah, it actually would cause it to dilate. You got it. So we'll talk about some of those examples here in a little bit. In fact, this is what the slide here is showing you guys. So we have alpha 1, alpha 2, beta 1, 2, and 3. These are the subtypes of adrenergic receptors. So for the alpha 1 and 2 variety, these are just the subtypes of adrenergic receptors, right? Now, they're subtypes because they have different effects, and they're found in specific areas of the body. So for the alpha 1 receptors, we find them in the gut arterioles, skin arterioles, and urinary and reproductive structures. So I'll have you guys guess this and actually make a lot of sense. If you are sympathetically active, do you need to send a lot of blood flow to your gut muscle? No, right? How about, do you need to send a lot of blood to your skin necessarily? No. Maybe to cool off, but not because your skin needs more blood. In fact, you're going to divert blood flow away from skin deeper towards muscle, which would need it more when you're sympathetically active, right? How about your reproductive structures? No, exactly, because remember, increase in blood flow in erectile tissue is not sympathetic, it's parasympathetic response, right? So what we find then is that the response of alpha 1 receptors on gut arterioles, skin arterioles, and urinary structures is vasoconstriction. So that if you activate an alpha 1 receptor, that's going to cause vasoconstriction in the gut, skin, and urinary reproductive structures. And that makes sense, right? So what if you gave someone a drug that blocked alpha 1 receptors? What would that do to blood flow in their digestive tract? Yeah, it would increase it. How about you give them a drug that blocked alpha 1 receptors? What would that do to blood flow in their reproductive and urinary structures? Increase blood flow. You got it. Good. And so that's interesting. So just kind of consider that, you guys. Alpha 1 is gut, skin, urinary repro, and it causes vasoconstriction. Vasoconstriction is where the blood vessels actually narrow, and so that you actually get less blood flow as a result, if that makes sense. Okay. Now, alpha 2 receptors you find in the gut muscularis externa, okay, and that's basically just the gut muscle itself. Now, these alpha 2 receptors, their function is to cause GI muscle relaxation. And that makes sense with respect to the effect of the sympathetic nervous system, right? Like if you're sympathetically active, do you need your stomach to be, churning and stuff? Do you need your small intestine to be propelling food along? Absolutely not, right? So what this allows for then is relaxation of that muscle. That way you're not having to, propel digestive contents around. Okay? So that's the other side of it. Is not only do you decrease blood flow to, the gut itself, but you also cause muscle relaxation of the gut. Now, let's say if you're sympathetically active, would you want your blood sugar to be high or low? Absolutely, right? Because you want to be able to supply your tissues with nutrients. So you also find alpha 2 receptors on the pancreas, because the effect on the pancreas is to actually increase the release of glucagon and decrease the release of insulin. Now, these are hormones that are released by our pancreas. The effect of insulin is to decrease blood sugar, but the effect of glucagon is to increase blood sugar. And it makes sense that if you're sympathetically active, and let's say like epinephrine and norepinephrine binds to an alpha 2 receptor on an endocrine cell in your pancreas, that's going to cause a lot more glucagon to be released by your pancreas. Now, what glucagon does is it causes your liver to start pumping out sugar into your blood. And it makes sense that you'd want to have higher blood sugar if you're sympathetically active, because you want to supply your body's tissues with enough energy to do those things, right? Fight, flight, fornicate. So it makes sense. But why would you want to decrease insulin secretion? Yeah, if the effect of insulin is to lower blood sugar, you definitely don't want to release insulin if you're sympathetically active, right? So that you actually decrease the release of insulin as a result of these alpha 2 receptors being activated. That makes sense, right? So where do you find alpha 1 receptors?
The gut, skin, and reproductive organs.
Good. Gut arterial, skin arterial, and arterioles that go to the urinary and reproductive structures, right? Does it increase or decrease blood flow to those organs? Decrease. If these alpha 1 receptors are activated, it decreases blood flow to gut, skin, and urinary reproductive structures. How about for these alpha 2 receptors? Where do you find those?
The actual gut muscle and the pancreas.
Yep, you find it in the gut muscle and in the pancreas. What does it do to gut muscle? Relaxes the gut muscle, but it also causes the sphincters to contract, right? So you want your sphincters to be tight, that way food's not moving around, but you want the rest of the gut muscle to relax, that way you're not having to churn food, right? How about, what's the effect of alpha 2 receptors on the pancreas? Good. Decrease insulin, increase glucagon, and the effect of doing that is?
To increase the blood sugar.
You got it, increase blood sugar. That's the whole point, is by activating these alpha 2 receptors while you're sympathetically active, you can decrease the release of insulin, and as a hormone already decreases blood sugar, so you don't want to do that. And simultaneously increase the release of glucagon, which as a hormone increases blood sugar when you do want that. In fact, I've actually encountered a circumstance where I tried to exercise with low blood sugar. It didn't work out very well, you guys. I tried to go on a hike once, and my blood sugar was already too low, and I hadn't eaten that day. And we were hiking, and then all of a sudden, I just got dizzy, and I actually fell off the trail, and I started rolling down the hill. It was a steep hill, and my friends were laughing at me, like, because they thought I was joking. You know, I make a lot of jokes, right? Whatever. They thought I was intentionally rolling down the hill. I just basically like passed out, and I fell, and I was just rolling down this hill, right? And luckily, there's luck I didn't get cactus because there was cactus nearby. It's just because my blood sugar was too low. So, but it makes sense though. Like if you're sympathetically active, you're like on a hike. Yeah, you want to be more sympathetically active. That you want to get more release of glucagon to keep your blood sugar up. That way, you can power your brain and muscle to function while you're sympathetically active. That makes sense. Cool. So, what about the beta 1, beta 2, and beta 3 receptors? Well, beta 1 you only find on the heart. So what's the effect of beta 1? I'm sorry, heart and kidney. So what's the effect of beta 1 on the heart, do you guys think?
Increase your heart rate.
Yeah, heck yeah, increased heart rate and the force of muscle contraction. How about the effect of beta 1 receptors on your kidneys?
Increase renin.
Oh, okay. Yeah, we didn't talk about that yet, huh? So on the kidneys, renin is a hormone released by the kidneys that increases blood pressure. And that makes sense if you're sympathetically active. You'd want your kidneys to release a hormone that increases blood pressure because then you could have adequate perfusion of your tissues, right? So what if you had a drug that increased beta 1 receptor activity? What would happen to your heart rate? Increase, right? What would happen to the renin concentrations in your blood? Increase, right? And then both of those would help to increase blood pressure. Makes sense. So when you think of beta 1, you guys think of a blood pressure effect. So then when would you want to give someone a drug that blocks beta 1 receptors? Yeah, absolutely. If you have high blood pressure, right? So like propranolol blocks beta 1 receptors, and it's one that can depress heart rate and it inhibits renin secretion. That way you can decrease your blood pressure. Cool. How about these beta 2 receptors, you guys? Well, we find them in the arterioles of your heart, the bronchioles of your lung, the arterioles of your liver, and skeletal muscle. So, if you're sympathetically active, would you want to have increased blood flow in the heart muscle itself?
Yes.
Yes. How about increased airflow in the lungs?
Yes.
Yes. How about increased blood flow through the liver? Yes, because that's where sugar is being released, right? If sugar is being released by your liver, you don't want to have blood flow through that liver to pick it up. That way you can get your blood sugar levels up, right? How about, would you want increased blood flow in your skeletal muscle?
Yes.
Absolutely, right? Of course you do, because then you're going to be able to, deliver your skeletal muscle with nutrients. So what we find then is that beta 2 receptors then can cause an increase in blood flow by causing smooth muscle relaxation in bronchioles and arterioles of your skeletal muscle, liver, and heart muscle. And that makes sense. Why would you want more airflow if you're sympathetically active?
So you can run away longer.
You got it. Yeah, so you breathe and actually get away or fight or fornicate. There's always that third one you could throw in there, right? Yeah. That was good. Yeah, you gotta go there. Now, how about if you're sympathetically active, and why would you want to increase blood flow to your skeletal muscle and cardiac muscle? Yeah, so you can run, right? So you can deliver nutrients to your skeletal muscle and heart muscle. That way you can actually adequately do those things that are sympathetically active. So let's say if someone is having an asthma attack and their airways are tightening up, would you want to give them a drug that blocks beta 2 receptors or one that enhances beta 2 receptors? Enhances, you got it. So we call those agonists. So agonists enhance the effect of a receptor. So if someone is having an asthma attack, you'd want to enhance the beta 2 receptor activity. That way you can increase airflow, and that way they're not going to die of respiratory failure. And you can die from a respiratory failure associated with asthma attacks. So there's pretty severe asthma attacks that can occur, right? And then last but not least, you guys, beta 3 receptors. And you find them on adipose. So what in adipose we know stores fat, right? So if you're sympathetically active, do you want to release it in your blood or store it in your fat? Release it, absolutely. So beta 3 receptors are involved with lipolysis, which is the breakdown of fat into free fatty acids, and that way you can supply your body's tissues with enough energy to do your sympathetic activities, whatever those may be.